And it's all through me building a relationship with them. Because on that poster, you know, I labeled it Vonda's treatment plan. So they could clearly see this is my voice to you guys. And I was then talking to everyone, the cleaner, the nurses, the shadow doctors, everyone that came in my room, the priest. They'd all look at it and just read it. It was that checklist. It was organized in those headings, and because I was just teaching it in the classroom weeks before, I was like, right, this model, whare tapawha, is still alive. It's still in the health system. It's in the education system. I'm going to use it. Fast forward a year or two later, I'm nurses are having compliance training, and I'm in the room talking about the whare tapawha model, and they're all going, yes, oh, we wondered how that worked, because they've been taught it. And then when they see, oh, we're actually, I'm connecting with that on a skill level. They've been taught this, and you're connecting on it on a, oh, it's actually real for you. It became a teaching tool for them. And it became an empowering tool for me. So my hope is, as a teacher, is that those teachers out there are still teaching that model. We don't have to wait for another, you know, global epidemic, and then we go back to health and well-being models. That is entrenched in the way we look at our kids' holistic well-being, because they'll remember that model and they'll bring it into their adulthood. If there was a handbook for nurses to help guide those conversations and guide those actual events to be okay to do, we need to prompt those ideas. Things like, you know, the hospitals know that iwi need to be consulted as stakeholders. When I went in there, I was like, yeah, they're a stakeholder, all right. They're my whānau, they're my hapu, they're my resource, they're my cultural guidance. Nobody in here has asked me what iwi I'm from, and that's important, because they're all betting for me. They could provide resources that the hospital doesn't even know exist. But creating that pathway has to be more than just consulting at a policy level. They need to allow them to connect with patients. I have the privilege of sitting with some very bright, skilled, beautiful people in the health industry. They are supporting me right now. They're giving me an advocate voice, and I'm finding that it's getting great reach. So that was my intention, was to create a doctorate or a discovery around holistic wellbeing journey, empowering the patient using this model, and actually breaking it down into how does the nurse engage with the patient to create that discussion to happen. How could the doctors engage with the patient? With my master's in Māori and management, it allows me to look at that seriously at a doctorate level. Talking to nurses in the ward, they said, Vonda, this model, we get it. But how do we engage? How do we start that conversation? Because I'm Pākehā, or I'm Indian. Yeah. And I said, it's simple. You put visuals up on the walls that engage and say, you're allowed to talk about this. But our walls are too clinical. They don't have anything. They're white. And so are you asking, and are you inviting me to have this conversation?